I'd like to now begin to invite some people that represent unions and professional organizations to the lectern. I'd like to invite from the Healthcare Coordinating Council of CWA, District 1, Michael S. Gary.
Thanks. Good morning, folks. Thanks to all of our elected officials and all the representation we have here on this really important issue. I just want to let you know we work for CWA, which is the Communications Workers of America, but surprisingly enough, we represent 15,000 just in New York State healthcare workers. And those 15,000 members in District 1 of the Healthcare Coordinating Council, in all of our bargaining units, they're across all job titles, we firmly stand behind this bill. It needs to get passed. We have nurse practitioners, registered nurses, LPNs, technologists, technicians, dietary workers, service and maintenance, clerical staff, therapists, pretty much everybody. And this affects all of our members. It affects all of the public. The issue of workplace bullying, it's very serious, as you know, in hospitals. In the local that I came from, we just had one of our RNs who was assaulted by somebody, and that case is ongoing. It's very, very tough to come to work knowing that there's a possibility of that every day. Where our healthcare members work, it's a high-pressure environment. No matter what your job title is, though, and who your employer happens to be, CWA strongly believes that we have the right to work in a safe and healthy work environment. It's been defined by the Workplace Bullying Institute as repeated health harming, abusive conduct committed by our bosses or coworkers. Now, most Americans have clearly identified that they've either experienced this or at least observed it in their place of work. And in most cases, this behavior is brought forward to the employer and nothing's ever done about it. Quite frankly, sometimes it's ignored. The stress of workplace bullying has numerous health effects. They've been documented. You wind up with lower productivity, poor morale, an increase in lost work days, insomnia, high blood pressure, you name it, it's there. In many cases, some folks just give up and they leave the job. We don't want that happening. We know what's happened in the public eye. It's been very prevalent of late, unfortunately. But it's also we believe it should be entering into the public consciousness in the workplace. CWA firmly believes that the same level of concern that we see for the public should also be there for the workplace. Yet it's often misunderstood and sometimes it's completely discounted. But this bill will create a civil cause of action for employees to bring suit against their employers found to have caused or maintained an abusive work environment. It's also going to provide a legal avenue for employers to follow should they have been bullied. We've supported the prevention of sexual harassment, and this law pretty much mirrors that in many ways. And as healthcare workers and representing CWA, those 15,000, we firmly stand behind it. It's time to pass it. I'm glad to see everybody's here. And thank you very much for letting me speak to you today on it.
Okay. Next, we will hear from Iris DeLutro with the Professional Staff Congress.
Well, I want to echo the sentiments of everyone else here by thanking Senator Diane Savino and Assemblymember Engelbright and all the other people that have sponsored this bill, co-sponsored this bill. It's clearly time to have a law that says you can't get away with this insidious behavior anymore. I am Vice President of the Professional Staff Congress, and in that role, I go through many of our 23 campuses throughout the year, and I cannot tell you how horrific it is to listen story after story of how our members very often are deprofessionalized and how they're targeted and how they work under such strong intimidation areas. And I can tell you that the statistics on this is really clear. When a person is targeted, a couple of things happen. Either they stay and become ill in the process of, saving their job, or they are fired, or they leave because they cannot take it anymore. The psychological violence that comes about as a result of being targeted systematically over and over again, it's not easy to take. Often the families know way before anybody else that a person is a target because that individual is no longer functioning the way that he or she should function. I can relate to you a couple of stories that I think are important to hear, because we know what humiliation, intimidation, and harassment is, but here are some ways how it really creeps up. I have a member that was the director of a program for many, many years. A new director comes into the place, and all of a sudden, negative evaluations come aboard. The member had the audacity to actually, not do something that was improper and unethical, and for that reason, that individual was targeted, and it has made that individual's life absolutely horrible. The evaluations all of a sudden became a bad thing. They no longer, a person that has been working for 20-something years in the same place, all of a sudden doesn't know how to do her job. The professionalization of her work, an individual that used to be a high-profile individual going out to different places representing the program, all of a sudden she doesn't even know when these functions take place. And then there is the alienation, because the word, you're either with me or you're against me, makes it so that that individual all of a sudden finds him or herself alone. Okay, and I want to tell you, it's not comfortable for the person that sees this kind of violence either, because as much as they may want to stand up, they won't do so because they're afraid of becoming a target themselves. So, there are many, many parameters here that we have to take a look at, but more importantly, it is a human right to go to work in an environment that is free of intimidation, free of harassment, free of any of the things that makes it impossible for you to do your work. And it is also a very costly thing for the employer. I can cite one case in particular where it cost the city university $1 million because of a bullying case of two individuals that for 8 years were bullied, deprofessionalized, stripped of their work, and then held accountable for the work that they were not given. After 8 years of struggle with the EEOC, with trying to work it out with the union, with everything else, they finally ended up in court and sued the university and won. But what normally happens is you get settlements. Settlements that does not hold the institution accountable, or, so what happens is you sign a paper, nobody knows what happens, and the practice continues. We need this amendment to this labor law. We need to be able to say to people, it is not okay to bully people. It is not okay, right, to create psychological violence. It is not okay for you to cost the institutions that we work for money and to lower the morale for everyone around them. So I want to thank everyone here. We want to also urge our partners out there, the media, other coalitions, nonprofits. We're all in this together. The time has come for a bill that protects the 99% of this country.
Okay, next I would invite to speak Tom Commanzo with the Public Employees Federation.
Good morning. As Tom said, I am Tom Commanzo. I'm a statewide vice president for the Public Employees Federation. PEF represents approximately 55,000 members in state agencies throughout the state. We represent both institutional members and administrative members. PEF fully supports the healthcare workplace bill and will do everything we can to help ensure its passage and enactment into law. We've seen bullying become much more prevalent lately, and it happens everywhere. It happens in institutions. It happens in administrative settings. And it can be employee to employee. It can be supervisor to employee, and any other iteration that they can find, it will be happening. PEF's Health and Safety Department has been very active in developing workplace bullying programs or workplace bullying prevention programs, and will continue to do that and offer it to all state agencies. Right now, there's a very good program being enacted in the Department of Tax and Finance that their administration has been very helpful in implementing with us. When you are bullied, you don't realize it, but it affects every aspect of your life. It permeates your entire life. It affects your self-worth, and everything you do, you know you're being bullied. And I'm stumbling a little on my words because unfortunately I was also bullied in my workplace. And as I said, it's been several years now, and I can say it without feeling my blood pressure go up, but you don't realize exactly how much it can affect you. In my situation, I had the respect of my coworkers, the other state agencies I dealt with, the vendor community I dealt with, but I had a supervisor that tried to make me her whipping boy. And at every opportunity, every day, that was her modus operandi. And it became very uncomfortable to the point that eventually I left the team. And it was like I said, it was a very unfortunate circumstance to have to go through. Things like or making me do a memo of justification 7 times. No time was good. My work isn't perfect, but I didn't need 7 revisions. Holding a letter on her desk and then asking me if I had dealt with the letter yet. That kind of situation. So obviously, not only PEF, but me personally, we fully support the healthy workplace bill, and we'll do everything we can to help it be enacted. So I thank you for your time today.
Next, I'd like to call an invitation to speak to John Richter from the Mental Health Association in New York State.
Thank you, Tom, and thank you, everybody, for being here and dedicating your time to this issue. My name is John Richter. I'm the Director of Public Policy with the Mental Health Association in New York State, also known as MHANYS. We represent affiliates throughout the state who work every day to promote mental health recovery, eliminate discrimination, raise public awareness, and to educate the public in general about issues of mental health. So what does the mental health issue have to do with this particular one? Others have already alluded to it. You know, a healthy workplace is a place that's hygienic both physically and mentally. It's a place where we should expect and have a right to go and work 20 or 40 hours a week, which is an integral part of our lives, and be free from the kind of harassment and abuse and the things that, from the mental health standpoint, are often unseen, as opposed to the things that are more tangible that one might think of when they think of an unhealthy workplace. It is very hard to measure what happens to somebody as a result of repeated exposure to this kind of abuse. But we see it as our responsibility to make the unseen more seen. It's a complicated issue. I wish I could have had time to spend. It's very nuanced to go over why this is a mental health issue. But to kind of put it in perspective, I'd have to quote the World Health Organization, who said something as simple as that without mental health, we have no health. And when we consider that 1 in 5 of us over the past year has either had a mental illness or experienced an acute episode of mental illness, we realize how pervasive it is in our society. So you've got people who are already living with a mental illness who go to work each day, and perhaps no one knows it because they don't talk about it, because stigma is another issue. But those people are then maybe without proper recourse like this bill is proposing, those people will be exposed to a situation for which they're particularly vulnerable for, although we wouldn't necessarily know that because, again, it's an issue of privacy for a lot of people. If I hurt myself on the job, or if someone hurts me on the job, and I come in with a black eye or some other obvious physical injury, I get the sympathy of my coworkers, and I'm not afraid to talk about it either. However, if I've been abused repeatedly at work and I develop psychological symptomology, the likelihood of me going into work and sharing that with coworkers and bringing that out in the open is very low. So what we need is for people who are in that position to have some kind of a resource to go to. And what we need as a public is for us to be more aware of how important our mental life is to us every day, and what it can do to us to be bullied at work in this manner. You know, bullies grow up, and I believe that when they grow up, they get more sophisticated. And I never underestimate how maniacal people can be and malicious people can be, and how sophisticated their bullying behaviors can become, and they become less visible to us. So the Mental Health Association supports this bill 100%. We believe by helping to limit the occurrence of abuse in the workplace and providing a viable recourse for victims of abuse, this bill takes a stride toward helping to protect everyone's health and mental health while at work. Thank you.
I'd like to invite Brett Scudder from CISFI to the podium now.
Good morning, everyone. I just want to say it is an honor to be here today because standing here with all these great people for this bill signifies something that my organization sees as a pain process every day. See, a lot of times when we look at the issues, we don't see what's happening on the back end. The impact on our children, the impact on families, the impact on communities when an abusive workplace environment gets into the homes. You know, we talk about the individual, but we also need to look at the responsibility that individual has to their families, friends, and their communities. We support this bill on a number of different levels because, as I said, as a youth serving provider, we are in our communities seeing the impacts on this. Increasing crime, increasing violence, a lot of homicides, a lot of issues that are stemming from the workplace that are branching out into the homes and into the communities. If we do not pass this bill, I can guarantee you right now that the increase in violence that we're going to see in our communities as a result of the harder economic times are going to make it so much more prevalent in our communities that the loss of life, the mental health issues, the psychological issues are going to be astronomical. So I want to say thank you to our elected officials who see the value of this bill. I can tell you personally, I represent numbers that I cannot share with you on a large scale. But the Mental Health Association, for you guys to be here as well to support this bill, we are very grateful for that because that has been the key part of what we're missing in a lot of these issues. And if we look at what's going on today with the bullying and the suicides that's going on, it's all mental health. All mental health issues coming out of the workplaces, families breaking up, kids going to school because they see their parents stressed out coming home because they had a bad day at work from a boss that really didn't care much for them. So we support this bill on all levels, and we hope that this year we'll see it pass. Thank you.